Nice to be at LSI for my first meeting here. So our summary, we are a total digital surgery platform. So my background is I'm a surgeon, I'm passionate about patient care, and that's what's driven our development of this platform. It's been used in over 941 different types of surgery or interventional procedures. We're revenue generating in 2023, over $3 million of revenue, and over 180,000 patients have used the platform. Various compliance accreditations, and we're deployed in Europe and Africa, and we'll deploy in America and Australia in Q3 of this year. If we think about the surgery market for a second, it's enormous. I'm a knee surgeon, and in the US, over $26 billion of joint replacement will be done by 2027. 80 to 90% of those will not be done in hospitals, they'll be done in ambulatory surgical care centres. So the model of care is changing dramatically in America. If we look at all surgery, which is what we cover, over $200 billion just in the US. It's enormous. But there are problems, and as surgeons we recognise those problems. Our failure to optimise patients' health prior to procedures is huge. It's one of the key things that the American Association of Anaesthesiologists is focusing on, doing patient assessment and optimisation at home. It's a key programme for them. Our ability to risk stratify patients, which patients go to an ASC, which patients shouldn't go to an ASC to prevent complications of care. And loss of revenue for institutions through poor coding and our exhausted staff. Wherever you are in the world, we've all been decimated by COVID and we're all pretty burnt out. But interestingly, if I look at my own specialty, orthopedic surgery, over 85% of orthopedic surgeons surveyed at the American Academy of Hip and Knee Surgery do not use digital tools in their practice. It's a huge market. How do we solve the problem? We developed a patient-centric app, advanced care management app, which basically tags a patient to an institution. It engages them by allowing their care from the first point of contact, whether it be by face-to-face or virtual calls and file transfer, right through to their perioperative care, their education, their consenting process, followed by their virtual ward and the recovery. The aim is to engage patients, be interactive, collaborate, bring their family and carers into their care program so they understand what's happening to that care individual. It personalises their care and prevents travel and attendances to surgeon offices, which is important to avoid time off work in particular. All that data is linked into their institution. So by coming into that institution, it's then filtered in a very smart way with very smart workflows to improve efficiency of staff. So it improves time, which equates to improved costs. It optimizes their care and actually then generates coding information, which improves our reimbursements. Once they've left hospital, you can then virtually follow those patients up if you wish in our virtual ward, which has been fairly well established. Looking for complications, preventing ED admissions, which eat into your 90-day billing cycle. We connect the whole pathway, so taking data from the first patient visit right through to the end result in short and long term, whether it be arthroscopic type data, as you're showing here, robot data can also be imported, and all that information goes into a massive data platform. You heard a lot yesterday from a keynote speaker about data platforms. Well, we have over 300,000 data sets, and the key thing is you don't have to be the University of California. By having your own data sets, you can dive in and get surgery-specific data about your patients and what's happening to them. You can get institutional data about what's happening to your health population and how you should help your health population around your institution. Or you can get pathway control, knowing where your patients are within their own pathway. And it's really important because what we then do is we help organizations increase their revenue through accurate comorbidity and saving costs through efficiency. So if a patient comes to see us in our surgeon offices at the moment, we have very little healthcare information about them when they come to see us, which means when they come to surgery, all that information has to be collected. It takes time and effort from our nursing teams and our PA teams, and that costs money. If we fail to identify key comorbidities, massive studies in the US have shown it will increase costs for inpatient care by up to $3,500. That's a big cost for ASC centers. And our failure to code, big paper by Bill Roach in Florida, showed that actually failure to not code 10 key comorbidities costs up to $2,000. Digital solves that problem because we get that patient information in advance. We can use that information to speed up efficiency, improve our optimization to reduce those perioperative costs, and improve our coding. And if you look at this coding, By us doing our clinical work well and generating those codes in the background, it changes our DRG code. So in this example here, the patient information has been set up, and actually the DRG codes for total knee changed from a 470, which generates $11,000, to 469, which generates $8,000 more per hospital visit. That's a big increase in revenue for the hospitals. The risk stratification we provide means that at an early stage you can decide which patients go to ESC, which patients are suitable there, which obviously surgeon owns, and which ones should actually stay in the major hospitals. So across the entire workflow, from the first patient visit, preoperative care, intraoperative data, post-op virtual ward and outcome measurements, we reduce face-to-face appointment and massively increase patient satisfaction. So what's our value proposition? Well, for patients, it's improved communication education. We need to engage our patients and get them better. That's what we want as surgeons. And it improves patient satisfaction, so they return to us and our institutions time and time again. For staff, we are improving their efficiency, reducing their manpower pressures on them because they're burnt out already and leaving us, and we're improving reimbursement of surgeons, whereas for the organizations, that reimbursement equates to improved CPT codes and increasing revenue. Reduced costs for optimization and improves patient safety, and we're interoperable with all the major EMR systems, so Epic, Cerner, etc. So what that produces is better value-based care. We've got lots of evidence around this. We've improved time saved. So in one study of 5,000 patients, we saved over 9,500 patient hours of time, 2,500 outpatient episodes, and over $250,000. We improve capacity, we improve efficiency, we reduce costs by using digital effectively in our surgical pathways, improve revenue, and reduce workforce pressures. And as I said, over 180,000 patients in lots of institutions have benefited. Our entry to the US is based on a strategic partnership. This particular one is with Think Surgical, a US robotics company that will disrupt the US marketplace. Not only because they're robotics, because their view about taking the entire digital journey and having robotics in the middle of it. It's a distribution agreement and will add a value add to the service. And we'll continue to look for more strategic partners around the robotic and non-robotic space who will add value. Our ask is very simple. We're about to go to Series A based on our revenue stream of about $5 million, and that's to fund our clinical patient economic studies here in the US and also facilitate our AI machine learning from our massive data lake and our automation program. Why would you invest in these pretty difficult times? Well, the global surgery market's pretty big. It's about $500 billion globally, and we're already established in Europe. We're about to have multiple sites in the US and Australia by the end of this year. We're already revenue generating, and we already have strategic partnerships. So we're well on our way. If you're interested in having a chat, I'm around. My contact details are here. Thank you very much for your time.